Have you ever wondered what really happens during a human operation? From the moment a patient enters the operating room to the final stitches, every second is carefully planned by expert doctors and surgeons. In today's video, we'll explore the complete process of a human surgery operation in simple and easy-to-understand detail. Before surgery begins, the patient is carefully examined. Doctors check blood pressure, heartbeat, oxygen level, and medical history. The patient changes into a hospital gown and is moved to the operation theater. A team of surgeons, nurses, and anesthesiologists prepare special surgical instruments that are sterilized to prevent infection. The next important step is anesthesia. This medicine helps the patient sleep deeply and prevents pain during the operation. There are different types of anesthesia: local anesthesia for small surgeries, regional anesthesia for specific body parts, general anesthesia for major operations. During surgery, machines continuously monitor the patient's heartbeat and breathing. Once the patient is unconscious, the surgeons clean the skin using antiseptic solutions. Bright surgical lights help doctors clearly see the operation area. The surgeon carefully makes an incision using a surgical scalpel. Special instruments are used to control bleeding and protect nearby organs. Every movement inside the operating room is precise and controlled. Scene 4. Main surgical procedure. The main operation now begins. Depending on the condition, surgeons may remove damaged tissue, repair organs, stop internal bleeding, or transplant body parts. Laser surgery, robotic surgery, microsurgery, laparoscopic surgery. These methods reduce pain and speed up recovery. Closing the surgery. After the procedure is complete, surgeons carefully close the incision using stitches, staples, or surgical glue. The wound is cleaned and covered with sterile bandages to protect against infection. Modern hospitals often use advanced technology such as Scene 6. Recovery room. The patient is then transferred to the recovery room. Doctors monitor breathing, heartbeat, temperature, and pain levels. Some patients recover within hours, while major surgeries may require days or weeks of healing. Human operations are one of the greatest achievements of modern medicine. Behind every successful surgery is a skilled medical team working together to save lives. If you enjoyed this video, don't forget to like, subscribe, and turn on notifications for more amazing health and medical content. Inside a human surgery, full medical operation explained. Human surgery is one of the most advanced achievements in medical science. Every day, doctors perform operations to save lives, repair damaged organs, and treat serious diseases. But what really happens inside an operation theater? How do surgeons perform complex surgeries with such precision? In today's video, we will fully explain the complete human operation process, step by step, from patient preparation to before. Before any operation begins, doctors first examine the patient carefully. This includes blood tests, X-rays or scans, heart monitoring, medical history review. The purpose is to make sure the patient is healthy enough for surgery. The patient is asked to stop eating several hours before the operation because anesthesia works more safely on an empty stomach. Meanwhile, nurses prepare the operating room with sterilized surgical tools to prevent infection. Recovery. Preparation before surgery. Entering the operation theater. The patient is moved into the operation theater on a hospital bed. Inside the room, you will usually see surgeons, assistant surgeons, nurses, anesthesiologists, monitoring machines. The room is kept extremely clean and bright to maintain safety and visibility. Anesthesia explained. One of the most important parts of surgery is anesthesia. Anesthesia prevents pain and keeps the patient comfortable during the operation. Thanks for watching. There are 3 main types. Human operation details. Full explanation. A human operation, surgery, is a medical procedure performed by doctors called surgeons to treat disease, injury, remove damaged body parts, or repair organs inside the body. Main steps of a human operation. 1. Patient checkup. Before surgery, doctors check blood pressure, do blood tests, scan the body, X-ray, CT scan, MRI. Examine the patient's health condition, curious. Anesthesia. Doctors give anesthesia so the patient does not feel pain. Types include general anesthesia, patient sleeps completely; local anesthesia, only one body part becomes numb. Operation theater preparation. Inside the operation theater, surgical tools are sterilized. Doctors wear gloves, masks, and gowns. Machines monitor heartbeat and oxygen. Making the incision. The surgeon carefully cuts the skin using surgical instruments to reach the affected organ or body part. 5. Main surgical procedure. Depending on the disease, remove damaged tissue, repair organs, stop bleeding, remove tumors or stones, replace body parts if needed. 6. Closing the surgery. After completing the operation, doctors stitch the cut, clean the area, apply bandages. Recovery process. The patient is moved to recovery. Doctors monitor breathing and heartbeat. Medicines are given for pain. Healing may take days or weeks. Common types of human operations: heart surgery, brain surgery, kidney stone operation, appendix surgery, cesarean delivery, C-section, bone fracture surgery, organ transplant. Human operation details, complete explanation. A human operation, also called surgery, is a medical procedure where doctors use special tools to treat injuries, diseases, infections, or damaged organs inside the body. Full human operation process. 1. Medical examination. Before surgery, doctors examine the patient carefully. X-rays or MRI scans. Heart and blood pressure check. Allergy and medical history review. 2. Preparing the patient. The patient is prepared for surgery. Special hospital clothes are worn. The surgical area is cleaned. Thanks for watching. Food and water are stopped for several hours before operation. Hello everyone, welcome back to the channel. Today we are going to explore human operation, full details explained step by step. Have you ever wondered what really happens inside an operation theater? How doctors prepare a patient, perform surgery, and save lives? In this video, we will explain the complete surgery process in simple and easy language. So watch till the end because this video is going to be very interesting and educational. What is a human operation? A human operation, also called surgery, is a medical procedure where doctors treat injuries, diseases, or damaged body parts using special medical tools. Operations are performed in hospitals inside a special room called the operation theater. Surgeries can be minor surgery, major surgery, emergency surgery, cosmetic surgery. Doctors perform surgery to remove disease, repair body organs, stop internal bleeding. Preparation before surgery. Before surgery begins, doctors carefully prepare the patient. Medical checkup. Doctors first. Check blood pressure. Test blood samples. Perform X-rays or scans. Review medical history. Fasting. Patients are usually asked not to eat or drink for several hours before surgery. Replace damaged parts. Save a patient's life.